Hi, I'm Dr. Cora Bruner, and today we're going to talk about some tips for your teenagers when you're concerned about their mental health. During this time, all of us are very stressed out, but we are very concerned as well about our teenagers. How are they doing? And how are you supposed to check in with them without feeling like you're in their face or being a helicopter parent? There's a lot of things we can do as parents to make sure they're okay. One is to just gently ask them at the beginning of the day, what are you going to do today? Or how do you feel about getting out of bed right now? And what are your plans for the afternoon? Just basic, innocuous questions that aren't really judgmental and don't go straight to the, I think you're depressed, because kids don't like to be asked these questions. So what do you do when they answer, I just don't want to get out of bed today? Or I'm just feeling sad, I miss my friends. Or I just feel like there's no hope, this is never going to end. I'm never, ever going to be back at school again, and I'm frustrated. What did you do as a parent when they say this to you? Well, the first thing to do is just check yourself, make sure you're okay, because you don't want to jump in and start solving their problems. You want to listen to them. You want to make sure that they feel heard without jumping all over them as a fixer. You want to be a listener. And one of the things that's important to understand during this time is, instead of saying, I'm really sad for you, or I feel sorry for you, is to say, I feel sad with you, or I feel sorry with you, because we are all in this together. And when our kids think that we also understand because we too are sad, they are more likely to talk to us. They are more likely to feel like we are listening to them, and are at the end of the conversation feel like there's time to come up with a strategy to have them feel better. And how can they feel better? Well, they could just be talking to you. Sometimes that might be all they need to do. And sometimes they need to seek out professional help, like going to their primary care provider, their pediatrician, or even a mental health practitioner. But the first thing to do is to say, I am listening to you, and I want you to understand that I hear you, and that we're going to all be okay.